Good evening and hello. My name is Renee D. Warwick, and I am the founder of Uniquely and Wonderfully Made Ministries. Welcome to you all, and a special welcome to the new members of my community. I am glad to be able to talk and meet with you. Today, my presentation is on electroconvulsive therapy. In the 16th century, agents to induce seizures were used to treat psychiatric conditions. The therapeutic use of seizure induction was documented in the London Medical Surgical Journal in 1785. The dawn of electricity's therapeutic use was in 1744. It was documented in the first issue of Electricity and Medicine. Convulsive therapy was first introduced in 1934 by a Hungarian neuropsychiatrist, Ladislas J. Meduna. He is the father of convulsive therapy, electroconvulsive therapy. The first international meeting on schizophrenia and convulsive therapy was held in Switzerland by Swiss psychiatrist Max Muller in 1937. Electroconvulsive therapy is a psychiatric treatment where a generalized seizure without muscle convulsions is electronically induced to manage mental disorders that are resistant to other forms of treatment. The disorders are major depressive disorder, mania, and catatonia. The definition of catatonia is a psychomotor disturbance that may involve muscle rigidity, stupor, or mutism, purposeless movements, negativism, ecologic, and inappropriate or unusual posturing, and is associated with various medical conditions such as schizophrenia and mood disorders. The ECT treatment, there is more than one therapy session. The therapy is given 2 to 3 times a week until the patient is no longer suffering with symptoms. The treatments are given under anesthesia with muscle relaxant. For follow up after treatment, antidepressants are given to people who have depression. Lithium is found to reduce the risk of relapse, especially in younger patients. For people with mania, the therapy is used for people who are resistant to other treatments and who have severe prolonged mania. For people who have catatonia, the therapy is a second line treatment for people who do not respond to other treatments, but it is a first line treatment for severe or life threatening catatonia. The U.S. Surgeon General's report says that there are, quote, no absolute health contraindications, unquote. The use of therapy, in the use of therapy, the most common adverse effects are confusion, mental memory loss, and muscle soreness. There is an increased risk for people whose heart disease or aneurysm and those who have had a stroke. Cognitive impairment adverse effects are relatively uncommon. Acute effects of ECT can include amnesia for both retrograde or for events before treatment or anti-retrograde for events after treatment. Patients who receive pulsating electrical impulses have less memory loss as opposed to those who receive a steady flow of electrical impulses. There has been no evidence found that ECT causes structural damage to the brain. In 1999 report by U.S. Surgeon General states, quote, the fears that ECT causes gross structural brain pathology have not been supported by decades of methodologically sound research in both humans and animals, unquote. Dr. Charles Kellner is a prominent ECT researcher and former chief editor of the Journal of ECT. In 2007 interview, he stated, quote, there are a number of well-designed studies that show that ECT does not cause brain damage, and numerous reports of patients who have received a large number of treatments over their lifetime and have suffered no significant problems due to ECT. ECT can cause lack of blood flow and oxygen to the heart, thereby causing heart arrhythmia. Death is very rare and is 6 per 100,000 treatments. It has been found that ECT does not cause a change in a person's personality, nor does it cause dementia. It could cause a worsening of anxiety symptoms, including obsessional thoughts or panic attacks. The ECT is 15 to 20-minute actual treatment session, and there is a 20 to 30-minute recovery time after the session. The use of ECT was stopped in the United States in March of 2020. Thus ends my presentation for today. I hope that you found my talk to be both interesting and informative. I enjoyed speaking with you today. My next presentation will air on the fourth Friday of this month. Please listen and invite your friend to listen too. My website is uniquely and wonderfully made ministries.com. UNIQUELY and wonderfully made ministries.com. That's UNIQUELY and wonderfully made ministries.com. On it, you will find blogs and videos on the topic of mental illness. My email address is M as in Mary, I as in ice, the word recovery, RECOVERY 74 @ gmail.com. I repeat, M as in Mary, I as in ice, the word recovery, RECOVERY 74 @ gmail.com. Send me your questions and concerns and prayer requests. Invite me to come to speak with your group on a hot topic about mental illness. I am the founder of Uniquely and Wonderfully Made Ministries. My name is Renee D. Warring, and I am the warrior warring.